Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, everyone. Welcome back. I'm so glad you're with us today. So we're going to be talking about medical trauma for children and how medical trauma can impact kids and how to help our kids avoid medical trauma, but then also how to navigate if our kids are or have experienced medical trauma. We have an expert, Dr. Meghan Marsac. She's a pediatric psychologist and also a tenured associate professor at the University of Kentucky. She also works with Kentucky Children's Hospital. And she also does a lot of grant-funded studies to identify predictors and emotional and physical outcomes in the context of acute chronic medical conditions, developing and validating assessment tools, and creating and evaluating programs to promote recovery or adjustment to medical conditions in children and families. What an important topic. She is a leader in the field of pediatric medical trauma, and she has published over 65 academic articles, 10 chapters on this topic in books. And she also has co-authored a book for parents to use to help support their children through medical care, as well as care for themselves, Afraid to Go to the Doctor, Every Parent's Guide to Preventing and Managing Medical Trauma. She serves on the editorial board of the Journal of Pediatric Psychology and the Journal of Traumatic Stress. Okay, so this woman is amazing. And she is here to help us help our kids. She also, I forgot to say this, she has given hundreds of talks on understanding and promoting adjustment to injury and illness in children and families. And she's also the CEO of Cellie Coping Company, which has distributed thousands of coping kits to families and children with medical conditions. With that, I welcome Dr. Marsac.
Oh, it's so great to be here. Thanks for having me today.
Yeah, so we're going to be talking about something that is kind of a passion of yours, about childhood trauma and how to reduce the impacts or keep it from happening. So I'm so glad you're here because this is something that so many kids experience and can be really hard for them.
Yeah, I think that we know that trauma exposures are pretty significant across the United States and worldwide. In particular, my area of specialization is in helping kids cope with things that come across in medical appointments or through medical conditions.
Yeah. So what led you, was there anything specific that led you to kind of put so much energy towards this particular area?
I've always been really interested in pediatrics and working with kids. I love kids. Some of my first jobs, I worked in a kindergarten classroom and just really loved seeing how kids are resilient from hard things they go through. And then I also just had an interest around kind of the medical world and considered going into medicine, and then found just my pathway in helping children cope and helping with mental health with kids that were getting treatment for other medical conditions.
Love it. Okay, well, I'm so glad you're here. So let's start by talking about what are the most common ways that medical procedures or medical experiences can become traumatic for children? Like, why does that happen?
So it really depends on the kids and families. One of the things that's a little bit surprising to many people is often people think that the most kind of dramatic or most risky or scariest things that we would objectively say would be more likely to cause, trauma reactions or most likely to scare kids the most. For example, like a new diagnosis of cancer, that might be something that folks think, okay, that would be so traumatic for that child. But one of the things that we've actually learned over time is it's not necessarily what we would think would be like the most objectively frightening thing as adults. It's more, how does a child experience it themselves, and more, what is their perception? And so that could be something from like as easy as like a bad experience in a pediatrician's office. So if one of the times a kiddo goes in and just had a really bad experience there, they could come up and develop trauma over time. We see very commonly trauma reactions actually to needle sticks and shots. And many, many kids need to get injections and vaccinations and blood work. And as adults, we don't think that's very scary usually, although there are a lot of adults that have needle fears too.
Yes.
But
Yeah.
objectively, that's not something we worry about so much for kids. It's kind of
Hmm.
a normal thing. But for some kids, just the way they process the experience, it makes it more likely for them to kind of struggle over time with their emotions.
Yeah. So so I guess, how do we know if our kid has an experience, or like, are there predictors that tell us like a particular kid might have a more difficult experience? Or like, I know that as a kid, I hated going to the doctor to get shots. And every
Mhm.
time I would be like, Mom, are we getting shots today? And she, like, over time learned that it was better for her to not know, she thought. And so she would be like, I don't know what's happening today. And then, like, there were times where I would like refuse to go into the doctor's office, and
Yeah.
times that I actually, this isn't, kind of embarrassing to say, but like definitely a trauma response is I moved the exam table against the door to block them from being able to get in.
I mean, that seems about right. I work with kids and families like that with that. I wish I could say I'm so surprised that that ever happened. But that sounds like a very adaptive kid thing to do.
Yes, I was like, if you block them
Yeah,
out, then, I didn't think about me getting out, and, but
yeah,
it was like so scary because I didn't like the unknown, and I felt like I wanted to have some control over when I was getting shots, and like, even
yeah.
though I knew I needed them, I like didn't want to be surprised. And yeah, so many things. So like, how do we know? How do I help the old Bryce, the little
So
Bryce,
Bryce
navigate through that?
just gave like such a beautiful reaction or a beautiful example of that was certainly a medical traumatic stress reaction, right? I mean, that
Yeah.
was like a classic picture of something that you would see. Ones like that are kind of easy to find in kids. Like, so if you've got kids that are climbing behind the exam table, kids that are blocking the adults out, I've heard stories from some of my like adult parents or friends where they're like, yeah, I would sneak out and run away from the pediatrician.
Hmm.
Those are like the really obvious signs and symptoms. They're like, that is your child saying, I'm afraid of this. I do not want to do this. This is really scaring me.
Hmm.
And part of what you described there was actually kind of that fight or flight response. And
Yes.
so when you're having actual trauma reactions, that's that fight or flight response where your body gets all amped up.
Hmm.
Your blood is pumping. You're not thinking straight. So if you
Yeah.
think about the fight or flight as that's your body interpreting that needle stick as something that's really dangerous for you.
Hmm.
And so then you're responding in a way that makes a lot of sense because you are going to defend yourself against that danger.
Yes.
So there's a few different things to kind of keep an eye out for because some of them might be really clear, like what you described, Bryce, your experience. I'm guessing your parents might have been like, huh, she really is afraid of the doctor or afraid of
Yes.
needle sticks. That's
Yes.
not like they're not like wondering, could she possibly be afraid?
Yes.
Um,
Yes.
so there's a few different categories. So what you're describing is our kiddos where we see it more externalized. And
Hmm.
so they're the kids, sometimes we'll have kids that are like screaming and yelling or trying to hit or like push the nurses away or yelling. Those are the ones that it's like obvious to us. Like this
Hmm.
child's really afraid. There's something going on here. Then sometimes we'll also have kids they withdraw. So they do the opposite. So they get really, really super quiet and they won't engage and they won't look at you and they just kind of internalize that. And they're like panicked, but like on the inside and they just freeze up.
Hmm.
And so it can be tricky to figure out like, what's your checklist of things. And sometimes we miss supporting those kiddos that go that opposite direction because we don't always recognize it because they seem super cooperative. So that's
Yeah.
awesome that they're being cooperative and also something to keep an eye out for. There's a few different kind of buckets of symptoms we look at. One is
Hmm.
avoidance with Bryce. And Bryce, you described that beautifully. You're like, I don't want to go there. Don't want to be in that office. Maybe you can't get your kiddo in the car to go to the
Hmm.
appointments. Maybe if you talk about the appointment, they're like, la la la, don't tell me. I don't want to hear it.
Hmm. Hmm.
And that can be something from a simple pediatrician visit all the way to like if you're in treatment for cancer or things like that. Other symptoms that we see are re-experiencing. So if you've got a kiddo that is like talking over and over and over about it, or like
Hmm.
worrying up until the day, like let's say your mom gave you a week's notice, like in 1 week, we're going to go get your vaccines. And every night you're going over and over it and over it, kind of like reliving the last time that it happened
Hmm.
and bringing it back up. Sometimes you'll see it in kids play, like they'll play it out or draw it out
Yes.
and doing that, some completely healthy. If they're doing it over and over again, that might be a sign that they might need some more support.
Hmm.
And then two other things we see. One is like that hyper arousal, so that fight or flight. So where you see like your kid just kind of shifts and they get like really jumpy, or like the doctor opens the door and they like jump out of their skin. We'll see that sometimes, or the run away, like because your body's ready to get out of there. And then the other one that we see that's a little harder to kind of tease apart is sometimes we'll see just kind of general changes in mood that sustain. They're not just for that day, but like would be more common in kiddos that have like more frequent need for medical, where you'll see a total change in like them feeling like more down or more afraid of the world, or kind of like a bigger shift like that. So it's not an easy, yeah, okay, this is definitely the symptoms, because it can look different in all kinds of different kiddos.
Yeah. Well, and I was thinking, so when I was in school, we had fight, flight, freeze, right? Those were the responses. And now we have fawn, which is like complying to something you don't want to do because you think it will be over faster. Do you ever see kids like agree, like they don't want a shot, for instance, since we're talking about that, but they do it, but it's only like they don't really want to. Can that cause a trauma response too?
So, I mean, it depends on how your body's processing things. So
Yeah.
sometimes, and that goes, I think that's such a great example. And thanks for sharing that, Bryce. I think of the other direction of like the internalizing. And so you'll see them like totally freeze up, totally not engaged. And so I think it depends. If you just freeze up for a moment, you get your shut down, and then you're back to normal self and everything's fine. And you're going back, you're playing with your friends, you're hanging with your parents, you're okay to go back to the appointment the next time. That's completely fine. But if you're frozen up and then like you're not engaging, you're withdrawing more, or those kind of generalizes more, or every time you go to the doctor, you kind of shut down. That's where it's that symptom in kind of that other direction, like you described, that like you're kind of like freezing up, which also is something that we can help kids with.
Yeah. Okay. So the things we're looking for to say it could be early signs that there's like medical fear, because like it may be a fear, but like not quite to the level of calling it trauma, right? They're different, right? It's like, because I know as an adult, sometimes I don't, obviously we know that Bryce had some medical trauma now that I've shared my Dr. Fear story, but like, like there are times where it's like, I know, for instance, having a baby, right? Like I know I'm getting ready to go have a baby. Like I want that, but I'm also kind of nervous and like scared, even though like I want it. And so that would be fear, but like I might not feel like that was traumatic. So that can be different, right?
Brought that out, Bryce, because I think that can be something that can be really confusing for folks too. Because you when I think about like the range of the fears and like kind of what can happen when you go to the doctor's appointment, I kind of think about it in different levels. You've got like your first level, where you've got a kid they're just good at going to the doctor, nothing phases them, blood work, sure, here's my arm, whatever, do your thing. They're just, doesn't phase them. Adults too. So this can be true for adults too.
Yeah.
Then you've got that next level, some normative anxiety, like, you've never had a baby before. Having a baby might be scary, or maybe you did have a baby. So now having a baby could be scary, like in either direction. And the same thing with kiddos. If they, they've had a shot or blood work, and maybe they had to stick them a couple times to try to find the vein. And so they've got some anxiety in their, but I think with that, those kids are easy to settle, and like they'll still do it. They might say, Mom, I don't want to do this. And you say, okay, I hear you. We got to get through this. And it goes along fine. That's completely normative. Then you've got your kiddos that like have a little bit higher anxiety, where maybe you're practicing some coping with them, practicing some deep breathing. You can kind of coach them through it. And like, they're not maybe blocking the door from you entering, or like climbing behind the table to totally avoid, but like you can tell they're starting to breathe really fast but then when it's done and they're good to go. When it hits that trauma point, that is a little bit more elevated. So those are kids that sometimes, at least in the beginning of that, need help. Sometimes they might need their arm held still. You might have to do a whole coping plan and coach them through it. You might need to be communicating with their medical team ahead of time to set everything up so that you get those expectations. Those kiddos might need a mental health provider to help you and them kind of walk through it. So there's kind of that different range, and different strategies can work depending on where you fall in that range.
Yeah. Okay. So question. I'm thinking about like, there have been times where I have 4 kids, and like every one of my kids has different responses to going to the doctor. They like their doctor. And I think in a clever way, most doctors aren't giving the shots. And so Like, I know that's like maybe not exactly by design, but it works out because then you can still like your doctor, but hate getting shots and still
Yep,
like go
I've
to see
thought of
that person.
the same thing that, like, because the doctor needs that, especially pediatrician needs that strong,
Yes.
trusting relationship with the
Yes.
patient, and so
Yes.
I've noticed that same thing. Yeah.
Yeah. So I like, there have been times where it's like, I have like struggled with myself to be like, okay, we need this blood work done, right? Like
Mhm,
maybe it's not emergent, but like we need
mhm,
it done to find out what's going on in their body because there's something that we're curious or concerned about. And the question that, or like they need a shot, right? And it's like, okay, so do we like, I often give my kids choices, but I don't know if that's the right like
mhm.
option. But like, there are times where you may be like you need stitches, but it's like not a choice. Like you have to do it. So like, do
Right.
we force our kids into situations? Like, how do we navigate that part in avoidance to creating medical trauma? Obviously, as parents, we don't want to contribute to that, but we also know that like there's things they have to do. So like, what is your advice around that, those kind of situations?
Oh, that's such a beautiful question. I think that is something I often will encourage parents to talk about with their pediatricians to determine what is a I need this now. What is
Hmm.
we need this, in the next month? What is we would like to do this, but if it doesn't work for your family, it's okay. So you
Yeah.
can kind of figure out and then have a game plan. One thing that I strongly encourage parents to do is be really clear for themselves if you're going into an appointment, what your plan is. So
Hmm.
when we partner with our kids that have either really high medical anxiety or trauma, we decide ahead of time exactly the plan. So, like, we'll say, okay, we're going to give you 1 minute to try this on your own. Can't do it on your own? Okay, we're going to help. We're going to hold safely and we're going to power through it because you need this for your health.
Hmm.
We will have like a whole plan, sometimes even starting the morning of you're going to wake up, what outfit are you going to wear? So you have it
Mhm,
planned out ahead of time. To have kids have like everything that they can expect, like to go the way that they expect it with what you can control. There's
mhm.
always things you can't control. So
Sure.
sometimes setting that all up. So I think the other thing that you said, I think, Bryce, that's so important is you never want to cause your child medical trauma or trauma of any kind. And sometimes to take care of your kids, their bodies react in a way in which they do have a traumatic response.
Mhm,
And it's not because you're a bad parent, it's because you're a good parent. Your
mhm.
pediatrician saying, we got to do this blood work because I need to make sure this is okay.
Yeah.
But I think kind of reframing that is to being like you as the parent are caring for them. And then what you will do is you help them cope with that. And if
Mhm.
they have a traumatic response that you need help with, you can get them mental health support and help them cope through that as well.
Yeah.
Um, I think one of the things that you said too in talking about giving your children choices, giving
Mhm.
some choices is fantastic, depending on their age, and you know your child better than anyone. Um, Giving a ton of choices can get
Mhm.
overwhelming. So
Sure.
once the anxiety is up, that's often a time to not give a lot of choices.
Mhm.
Before the anxiety is way elevated, that's a great time to give some control and some power. But
Mhm.
once you hit that elevated point, you just got to plan. You have a plan, and you kind of just go through it because
Mhm.
otherwise what we'll see is the choice will always be to avoid, 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 and then
Mhm.
the anxiety increases and increases.
Mhm. Mhm. Well, because we know that with anxiety, like it is a safety thing normally. Like our body
Mhm,
says we're
mhm,
definitely going to die if this happens, or
mhm,
whatever we see as the worst case scenario. And as adults, we may know that our kid is not going to die from the like my son last year fell on the stairs walking up and he cut his chin open,
mhm.
and we went to the ER to get, I was like, I don't know if it'll be stitches or glue or whatever it's going to be, but like we know that we need to take care of this today. It's not something that we can put off because there's a time factor to those kind of things. And so, it was like he was nervous about it. I mean, children's hospitals, I feel like have evolved so well in this for the
Mhm.
most part of like being able to do the least painful thing and like making it the most comfortable that they can and talking kids through it. And we had a great experience, but it was like I was nervous. I was like, okay, are they going to give him a shot to numb his chin? Like, what's this going to be like? And so I was feeling nervous, but like I knew we needed to do it. And so it's like I had this thought in my head, like, okay, do I hold him down? Right? Like, if we need to do this, is this
Mhm.
something that we would need to do? What are your thoughts on, like, I knew we needed to do it. And can it be something that is in our kids' best interest if we are like attending to their medical needs? And also, they have to be held down by other nurses, or
Yeah.
you are participating. Like, tell me How do we
Yeah.
handle this? Because it's so
Yeah.
hard
So
as
I
a
think
parent to know.
that's, again, just such a great question around what I keep hearing you say is like, I'm trying to be the best parent I can. And I think a lot of parents out there can resonate with that, right? It's like, I
Yeah.
want to be the best parent. I want to take care of my child, especially in a moment where we're feeling nervous as parents, like, oh my gosh, my
Yes.
child has an injury. I've got to get them the medical care. What if my child can't deal with this? Then I'm anxious too.
Mhm.
What do I do in that situation? And so I think it kind of depends on the level of the care needed. So sometimes it depends on like how big the kids are too. Like sometimes
Sure.
when you get the little ones, it is more comfortable for a parent to do a hold it if you can hold them safely.
Yeah.
And if that's what the medical team there is suggesting and you feel like you can do that, sometimes
Mhm.
that is more comfortable for the child and the parent. I definitely think working with whatever medical team you are there to ask them. I have had parents that sometimes that's not the best choice for them because the
Mhm.
holding for them feels either too traumatic for them or they think that for their child, that will make their child like view them differently.
Yes.
And so I've even had parents who've had to leave rooms before.
Mhm.
And that's the loving choice they're making for their child. It's not, I'm abandoning my child. It's that I know my child will do better in the long run.
Mhm.
I'm going to let this team of nurses and doctors who I trust take care of this for our family. And
Mhm.
so, again, just like I think if you are unable to stay calm in the room, sometimes that is a choice that works better. And again, it depends on your kid and you and your family's relationship. I have some families where if they've got a two-parent home or if they have like a grandparent where sometimes grandma always takes them because they do better for grandma or dad takes
Mhm.
them or mom takes them or stepmom takes them or there's like they identify one adult in the household that child just for whatever reason does better in that moment and they utilize
Mhm.
that like
Yeah.
utilize that relationship
Sure.
and so really tailoring it to what your child needs and how you and your family do best. So it's going to
Yeah.
look different for everyone.
Yes. So, but I also hear you saying that, like, in conjunction with your medical team, that like if I'm okay with it and I'm able to stay calm and holding my kid down as part of what they're going to have to do in order to make sure that this kid is safe for that, injection or stitches or whatever it is okay. Like that is not like I'm not doing the wrong thing by following the advice of my medical team or like being a participant if I can handle it.
Yeah, as long as you feel like you can safely hold your child. Again, sometimes as kids get bigger, you can't
My
safely
gosh,
do
right?
that.
So
And so as
powerful.
long as you
Yes.
feel like, you have that relationship with your child, you have the relationship with the medical team to guide you. Sometimes they might even be able to give you guidance on how to do that if that's part of what they're doing.
Yeah.
Or they're also trained. So medical team members are trained if it's something that is life saving or it's something
Hmm.
that they absolutely have to do for your child's care, they're trained to help your child get through that.
Yeah. Which can be so hard for us. So what I hear you saying also is that parent reaction or our emotions as parents can impact how our kids experience things. Is that something that you're also
Yeah.
saying? I kind of heard that like
Yeah.
covertly in there. Can you talk more to
Yeah.
that?
So we do know that kids pick up on what their parents are feeling.
Yeah.
And so it's okay to be anxious and nervous about something too. Like, I think if you are nervous, it can be even helpful to say out loud, like, I'm feeling nervous about this, and this is how I'm staying calm. I'm going to take
Mhm.
some deep breaths. Or I'm
Mhm.
feeling nervous about this. You know what? I'm going to ask the doctor for advice because if your anxiety is there and your child senses it, then what you can do is model like how do you
Yes.
deal with the anxiety and that can be really
Yes.
powerful for your child.
Mhm.
If you cannot keep your anxiety in check, like if it's like this is just way too stressful, maybe you had an experience in childhood that like really set
Mhm.
you up, so anytime you're in a medical setting you're like panicking,
Yeah.
that's probably a time to try to find another trusted adult to help your child through whatever they're going through,
Mhm.
because our kids pick up on us. The other thing
Absolutely.
that I think you kind of alluded to earlier that I think is really important is anxiety is not bad. I think it
Mhm.
gets kind of a bad rap, but anxiety is actually really adaptive and helpful and protective for us.
Mhm.
It's when it kind of gets misplaced or
Yeah.
kind of overstimulated, kind of gets bigger than it needs to be, where it kind of gets in our way. But
Mhm.
anxiety by itself is actually really, really healthy. And we work to teach kids about that too. Like it's okay to be scared. Yeah, I'd be
Mhm.
scared too. That's completely fine. We just
Yeah.
have to make sure that our feelings of scared or our anxiety doesn't get in the way of us getting done what we got to get done so that we can keep
Yes.
you healthy.
Yes. And I like to talk to, I talk to my own kids, but then in my practice,
Mhm.
I talk about like real alarms and false alarms because
Mhm.
I feel like our anxiety, our amygdala kind of reacts like a smoke detector. And so it's not the thinking part of our brain, just the reacting part. So it tells us danger. And
Mhm.
like, yeah, shots hurt, right? Like even as a grown up,
Mhm.
it's not like I love that feeling, but I know
Mhm.
that I'm going to be okay. And so we're also teaching kids how to navigate to get to that place. And so when we feel out of control or something feels like not within our power to control, our anxiety can get turned on. And then we can respond in that fight, flight, freeze, fawn way. And then, that's not our thinking part. Like, so our kids aren't being dysregulated or reacting to their anxiety in a bad way. This is just a normal body response because our brain doesn't know the difference between real alarms and false alarms. It needs the thinking part of our brain to say, "Hey, actually, this feels bad, but isn't going to like physically harm us or like isn't going to be like dangerous or isn't going to make us die, and that like it might hurt but we can get through it." And that's hard. When our thinking part turns off, we need our adults in our life to kind of be the thinking part to like help us rationalize through it, to maybe get our amygdala to turn down. Do you find that that's helpful for parents to do?
Yeah, I think that's wonderful. And also, I think you were talking about it. Oh, tell the kids in your practice to do this. And I think it's really important for parents to hear that information too. Because I
Yeah.
think one thing that's so easy to do as a parent is when we're trying to make our kids feel calmer, be like, oh no, it's not that bad. It's not
Mhm.
scary. It won't hurt. And
Yes.
and even if it doesn't hurt to us, it doesn't mean it doesn't hurt to the child. And so
Mhm.
focusing more on exactly what you described is, oh, yep, your brain is reacting strongly right now. How can we calm our bodies down?
Yeah.
And I can see that you're feeling really worried and more like validating what they're
Mhm.
experiencing
Mhm.
rather than trying to reassure them with other things that is not going to fit as well because their experience in that moment it is very, very scary.
Mhm.
And just telling them it's not scary, sometimes that just makes them feel like, well, you don't get it, you don't understand,
Mhm.
rather than having them have that like, supportive adult that is really understanding there.
Yeah. Yeah, totally. And it's hard. I think being a parent, there's a million books out there, right? Like a million parenting books. And what works for your kid, there is not
Yep.
one that fits all sizes and what your kid's going through or what your family's going through or what you've already been through. So I think it's knowing that like you are the most knowledgeable about your kid. And also like you've tried, I know there are things I've tried with my kids that don't
Mhm.
work, right? And like,
Mhm.
okay, never going to do that one again. That was
Like, yep,
fail, right?
whoops,
Like,
totally did that. Yep,
right. And then there's other things where I'm like, okay, that was good. Okay, that worked. That was like better. Okay, so put that back in the bank to like
yep,
remember for later, and know that like you can also talk to your kid if something doesn't go well to say like,
yep,
wow, that was really super hard, super
yeah,
super hard, right? Like I wonder if we could have done that differently. Like, what could I have said that would have helped? Or is there something the doctor could have done or the nurse could have done? Or what would have made you feel more comfortable? And sometimes they're just going to say, no more shots, right? Like, I'll
yep,
never do that again. And it's like,
yeah,
you have to be honest and say, like, if that's something that your family is doing, most schools require vaccinations to get into school. And so, to be like, okay, well, I hear you. Totally
yes,
understand that. Like, shots hurt me as a kid too, but here's why we do them, or here's why we do this vaccination, because this is what it does and this is how it helps your body. So I, as your mom, cannot tell you that I won't make you get a shot again. Like I can't. And I wish I could, but I also know that I need to keep you safe. And so is that helpful, like that language about talking about things, like especially if they didn't go well, to
yeah,
kind of
Bryce.
help?
I heard a couple of really fantastic things you said in there. Hopefully, I can remember them all as you were saying so many great
Well, thank
things.
you.
Hopefully, I'll remember what you were saying there. Because I think one thing that you said that I think is so super important was your honesty with your kids. And so you're like, I'm not going to just reassure them and say, no, we're never going to do that again, or surprise them with a shot one day
Hmm.
and be like, and you're building that trusting relationship with your child by saying, I hear you. That's
Hmm.
hard. Um, and we still have to do it.
Yeah.
Another thing you said in there that I think is so super important is giving them some information about why.
Yeah.
And so, depending on their development and their age, kind of, if you're doing vaccinations for your family, you're explaining what's the purpose of the vaccination. The
Hmm.
same as if you probably aren't letting your kiddo eat, just cookies all day, every day.
Yeah.
And so you're going to explain that. And like you explain, you go to the doctor to keep your body healthy, just like you sleep to keep your body healthy.
Mm-hmm.
And so if you need blood work or you need shots, it's to keep your body healthy. Some kids even, we've been using shots as an example, but other things, even like kids sometimes don't like their ears examined. I know
Yeah.
sometimes the nose swabs or like
Mm-hmm.
either the strep swabs can be really hard
Mm-hmm.
for some
Mm-hmm.
kids, and the nasal swabs can be hard. So it could be any of those things. And sometimes if you've had enough of those things that have been really tricky, even just going to your pediatrician, the kids are like,
Mm-hmm.
nope, I don't want to have any of it. So it can be
Yes.
any of those things. So I think, giving them that information, like you described, Bryce, I think is really great. Something else that I wondered for you, as you were describing, you tried one thing and be like, okay, that went great. I'm going to try that again. I was wondering, in your experience being a mom of 4, have you tried one thing with one child and you're like, that was awesome. I found it. I've got my solution. And then you tried it with another child and been like, that was awful. That didn't work at all.
Mm-hmm. Uh-huh.
Like, right? Because like different things work with different kids.
Yes. Yeah. That is like my parenting story. If we could summarize it in
Yeah.
one sentence, it's like what works for one kid does not work for the other. I mean, that's not always true.
Yeah.
Sometimes it does, right? Like it crosses the child to a different child, but oftentimes there are different strategies for different kids. Yeah.
I also, something that also happens to me as a parent and with lots of my patients is something's working and working and working. You're like,
Mm-hmm.
oh, finally, we got this figured out. And then one day it stops working.
Yes.
It's like, I don't know what happened. Did they went to bed and woke up a different, now this coping strategy is a goner. We're like,
Yes.
okay, back
Yes.
to the drawing board. So that's the other thing that is like, it's like an ever evolving process of what's going to work as your child kind of continues to navigate like really their health journey. If we think
Yes.
about, medical trauma, medical anxiety, what we want to do is really set kids up early on so that they consider they're not avoidant of their health over time,
Yes.
so to make it as like pleasant of an experience and giving them, even if they are nervous, that they learn to weigh the benefits over the nervousness that
Mm-hmm.
they might have
Mm-hmm. Mm-hmm.
as well.
Well, and I was just thinking as you were saying that, a lot of times I also see some adult women in my practice, and sometimes they'll say, like, my husband won't go to the doctor. And then it made me start thinking about, like, just in this second, like, I wonder if there's medical trauma in there that is like part of their avoidance. Have you done any like adult studies or like parent studies on like why, if there's avoidance of the doctor, why?
So one thing, I haven't looked at that specifically, but one thing that we've looked at and that there's really good research on there in the research world is that for kids that have any kind of medical condition, including an acute injury, so it could even be an injury like you described with your child of
Yeah.
having to go get stitches. 30% of kids will generally have some kind of medical traumatic stress symptoms or reactions. So will at least 30% of parents on average. And so
Wow.
even so, if you think about, the parents and kids interaction, and then you bring in with what you described of what has happened in that parent's past.
Mm-hmm.
And so we do a lot of education on our team with medical teams of what it like our families walking in the door, what have they been through? And
Mm-hmm.
so often, and you'll hear this a lot with dental anxiety, because
Yes.
dentistry today is a lot better than dentistry years ago, right?
Yes.
Like dentists now are trying to like make sure people are comfortable, manage pain, keep everybody healthy. The ability to preventive medicine and dentistry is so much better now. But you'll see this a lot with like the adults had such negative experiences that then they're bringing that with them and then
Mm-hmm.
with their kids in it. And then if the kiddos see the adult being afraid to go, it kind of
Mm-hmm.
builds on that cycle.
Yes, totally.
So we never know kind of what's in everyone's kind of past. And if you think about for yourself, you had a great example for yourself of a hard experience that you had
Yes.
as a kid. And I grew up, my dad's actually a dentist. And so I grew up in a dentist office. I have no
Mm-hmm.
dental anxiety, maybe to a ridiculous degree. I find it relaxing to go to the dentist,
Mm-hmm.
which might make me sound a little crazy, but that's kind of where I grew up. So it can go in either direction, right? Of
Sure.
like, you had some experiences that were really, really hard,
Mm-hmm.
or, maybe you grew up and you were exposed to stuff all the time and it was fine. But that could have sent the other way too, because I also worked in a dental office then as I like grew older. And so I saw the surgeries, I saw the
Mm-hmm.
difference. So that could have gone the other way. It just, for me, it
Sure.
happened not to.
Yes.
So just kind of thinking about what we're all bringing to the table when we're going to
Mm-hmm.
then as we're parenting our kids, kind of what's in
Yeah.
our background as we're trying to parent them through health and wellness.
Yes, which is so hard. I mean, like I said, there's no book on this, right? And so we're like learning it as we go. I mean, there are books, but like you have to know that you need to read the book, and then you have to have the time
Right.
to read the book and all the things. And so it's hard to because some of your kids might be totally fine with going to the dentist, and some of your kids might be really nervous. And so I think yes, it's so good to bring up the dentist because I think that is another one that there is a lot of anxiety or can be around that. And I think something else that parents that I know personally or professionally that have had their kids have a diagnosis where they've felt maybe dismissed by the medical community and
Mm.
have to keep
Mhm.
advocating for their
Oh my
kids
gosh,
to
yeah.
say like, hey, no, there's something wrong here. Like this
Yep.
isn't expected. Like maybe I don't know all the things, but like something's not right here. And so then I think those parents can also bring this layer of like not being believed to the table or having to like fight so hard for something. And so then their kids also see that.
Yeah, absolutely. I think the thing with in the medical system is that, I work in a healthcare system. I'm at UK Healthcare, University of Kentucky Healthcare, and we also talk about we don't know what happened in a child's healthcare before they got to us.
Mhm.
And so even if once they walked through our door, we gave them all the compassion care, we advocated, we've done everything we can, that doesn't mean that that's what they experienced
Mhm.
previously. And sometimes things happen and you don't even know. Like
Yeah.
somebody might have been, I mean, you have no idea what's in that background until parents start sharing with you. And I see a lot of patients that have like some chronic pain pieces, and
Mhm.
oftentimes they have been dismissed often by medical teams. And, then they're sent to see me and as a psychologist and to help with the pain. I'm like, not because we don't believe you, but I'm like, but there are things you can do to also help with things like pain
Mhm.
and anxiety.
Sure.
But we see that a lot too, of like, depending on what your past experiences with the healthcare system, it might increase your anxiety just to walk through the door because you don't know what kind of provider you're going to get or what you're going to have to
Yeah.
fight for that day.
Yeah. Yeah. And it can be so exhausting. So I certainly empathize with those parents of, having to
Mhm.
advocate for our kids because we are their best advocate. And so it's good for us to also let our medical teams know what our kids have been through or
Mhm.
what they respond best to if you do know, right? You might be like, I'm still figuring it out. I
Yep.
don't know. But like these are the things I know don't work, right? That's
Yep.
even helpful information to say, what hasn't worked in the past.
Absolutely. Like if you know if something like triggers your child, like
Mhm.
that's a great thing to share with the medical team. And some ideas too. I think highlighting parents as advocates is key. And it's hard because sometimes it's like, oh my gosh, you have to advocate for your child in every space you go in,
Mhm.
including the healthcare and medical environment. But we've been really successful sometimes when we'll make a plan ahead of time, and then
Mhm.
the parents will share the plan with the pediatrician or the providers. Sometimes too, if we're not sure if the like, can the provider set it up this way? Sometimes providers will do like a phone call with you or a parent only appointment. So if
Mhm.
you've got a kid with pretty significant anxiety and you're like, okay, this is what I think will work. Will that work in their clinic or will
Yes.
that work for that appointment? Or
Mhm.
sometimes even a nurse from the team will call and kind of review it together so that then okay, I can tell my child we're going to do this. And then you can even
Mhm.
tell your child, I called your doctor's office and they
Yes.
said we can do this. So you're going in
Mhm.
kind of more empowered than and it gives you a little more control and your child know a little bit more what to expect. The
Yes.
medical teams also like that too. I mean, most medical teams, especially people that work with kids, they
Mhm.
do not want your child to be distressed. Like it bugs
Yes.
everybody when the kiddos are having a hard time. So if
Mhm.
you have an idea about how it will go better, if they can accommodate it, often they will
Mhm.
try.
Yeah. Yeah. I think, I mean, and to emphasize that our medical team is really on our side. Like they want to do what's
Mhm.
in our kids' best interest. And some of those things, I mean, some of the stuff is hard, right? They
Mhm.
may have to say no to something that we think would really be helpful because of a reason. And so maybe it's also understanding that ahead of time so that we can explain why we have to do something different at this particular appointment if we are able to get that
Mhm.
information.
Mhm.
And so information is power. But also I think, I know that like for me, knowing a week ahead of time when I was a kid would have caused so much anxiety, right?
Mhm.
But like knowing like 24 hours in advance would have been enough notice to fret about it, but not enough to get
Mhm.
myself so worked up, right?
Mhm.
And so I think every kid is so different on
Right.
those planes. And so your kid and what would likely be the right timing to talk to them about it and give them information. And maybe you have one kid who needs less information. Like, don't tell me
Mhm.
all the things I don't want to know,
Mhm.
right? And then other kids who wanted to know every single detail as much as you can and that helps them to feel less anxious.
And Bryce, that kind of reminds me of something that you had said early on about giving choices.
Mm-hmm.
And so if you know in advance and you can say to your child, okay, like how far in advance do you want to know about a needle stick? And then you can see how it goes. And if you try it their way and you're like, okay, we're not doing that a week in advance again. Like my child thought they wanted that. No, that's not right. You can adjust, but you can do some empowering of them. We've had kids. So I see sometimes kids that are in the hospital for things. And some of our kids, they want to know every single detail of exactly what's going on. The doctors will often come in the room and they'll explain things and like right in the rooms. Other kids, that stresses them out. They're like, please go talk out in the hallway. But the kids that want them in the room, they're like, well, if they're talking in the hallway, it must be something bad because they're not talking in front of me. And so again, to your point, Bryce, around like really tailoring it for the individual child of like what's best for this child and like, your child best. We often say, I know you've said that a few times during this podcast here, and we often say like, you are your child's expert. Like, even if I've known your child for 5 years, like you spend way more time with them than I do. And so you are the expert on your child. And we want to empower and partner with parents around, how do we make this go better for your child?
Yeah. Okay. So let's say our kid has had a medical trauma, right? Okay. So we're at this place where we're like, their behaviors around the doctor, they're refusing, they're not going in, they're screaming, they're whatever the behavior is, but we know that, or maybe they just shut down, like literally they become robots and we're like, that is totally not like my kid. Like that is the opposite of what they're normally like. What approaches can we use as parents or the medical team to help them feel safe and supported during future medical visits?
So I think when it's at that level, I would definitely recommend working with a mental health provider, because I think once you get to that level, that's pretty escalated. And it's great for somebody to partner with your child, in that. There are some things that you can try also. So I think making sure you're communicating well with your child about what to expect can be really helpful. How old they are as to how much information you're going to give them. And like we said before, what your child prefers. Trying to set that up, creating plans ahead of time is really powerful. And I say sometimes in our sessions, we will even go out and like label out, okay, I'm going to wear my pink princess outfit, or I'm not going to get dressed. My mom's going to let me go in my pajamas that day. And mom's just like, whatever, we'll do anything. I'm going to bring my rainbow unicorn with me. We're going to listen to this show in the car on the way, like to really have it prescribed out. We do use the distraction leading up to procedures a lot. So if the family is okay with using tablets or music or any kind of distractors, like that's the time to go ahead. This is the time to take the screen limits off and just let your child distract. Like sometimes in the car all the way there, in the waiting room. I've had kids like even figure out how to, like, if they're young enough, they're either rolling in a stroller or a wheelchair all the way in, like on their tablets, so that they can kind of keep their mind off of what's coming, if that works for them. We do teach things like deep breathing or diaphragmatic breathing. That can help if a kid is not super escalated. Once they're like in that kind of big fight or flight, it's really hard for them to breathe slowly. So we tried all these things to try to keep them from kind of that escalation area. We do recommend often setting up reasonable rewards. And I don't know, Bryce, if you've had this in your practice, parents are like, bribes versus rewards. They're like, oh, I just got to bribe my kid. I often will describe them as a little different. Bribes you're throwing out when you're desperate. Like the meltdown's already happened. You're just trying to get through it. And sometimes a bribe is like, it's necessary to get through your moments. But a reward is more of advance. Like, here is what you need to do. If you can do this, you're going to get this reward. And what it does is it helps the child. You can keep reminding them like, oh, and I will just say this here. I've got a lot of kids on Starbucks rewards. I'm not sponsored by Starbucks. I have nothing to do with that for Starbucks. But like a lot of kids I work with, they pick out a specific drink at Starbucks. If they get through their needle stick or whatnot, that's what their family is going to do. Sometimes there's been other things, like they'll do like a special family time, a special family game. They'll pick what's for dinner. So you can make it fit within your family. It doesn't have to be monetary. It can be like a special activity, whatever fits for your family, and have it set up ahead of time with really clear, like, what do you have to do? Are you just, if you get through it and get it done? Because if a kid is really, really struggling, we want them to achieve that reward.
Yeah.
So the first time you go, if a kid has had a trauma and they're in that space, we would expect them to have a hard time during that moment.
Mhm.
It would take kind of a lot of practice and working through to get that calm back down. So just having really clear like rules around that reward. The kids that are younger, sometimes we'll do medical play or social stories with, where we'll walk through and have them pick one of their favorite buddies or stuffies and like do the medical exam or do the injections and have them teach their like little buddy the plan that they're going to go through as well. So we'll do some of that preparation work so that they're like, and even practicing a few weeks ahead of time with their buddy so that it's like fresh of mind and these concepts are not that kind of abnormal or whatnot.
Mm-hmm.
Those are some ideas
Yeah.
that we
No, I love it.
in the past.
And I love the idea that like we want them to get to the reward, because I think sometimes, I mean, it's so hard as a parent because you're like, okay, ideally I would like my kid to act like this, like A, right? But like, is that really possible in this situation, right? Like, even if we're looking at all behaviors on all settings, right? But specifically in this medical trauma situation, like, could you stay totally calm after having something that seemed traumatic to you, that was a trauma? I mean, I don't think I could, right? Like, I might fake it on the outside. Like, it might be an internal, right? Like, even as a grown up, that would be really hard. And so then to ask our kids to do that, if we can't, like, we want them to progress and we want them to get to the reward. And so like starting with our objectives low and then like building up, like, what do you think the next time could look like? Right? Like, what do you think could be different? Like, how do you think you could act? Or what do you think you're ready? Like, could we keep our voices quiet? Maybe we can't keep our body totally in control, but like we're not yelling or whatever it is that our kid thinks that we can do. And then we're looking to reward that. And then if our kids, I mean, I have kids who sometimes my kids will say like, oh, I could totally do this. And I'm like, I don't think we're quite ready for that. Right? Like, I'm not ready, but I'm like, okay, I think that's like best case. Could we also include this? Like, you would still get a reward if you did this, because I want, again, my kid to
get that reward. Yeah.
Exactly.
Yep. Yeah, I think that's exactly right. And then in thinking and celebrating really small successes. So if your child usually fights for 15 minutes to get in the car and they got in the car in 10 minutes, then you celebrate and praise and like reinforce the successes like as much as possible as well along the way.
So a question, do you think like saying words like "you're so brave" or "that was like such a big deal," like what can we say to like really reward, to let them know? Like, what are the words that are helpful?
Yeah, I think that, again, tailoring it to your own child and their ages. So sometimes with teenagers, I know we've talked a lot, it kind of sounds like this is just a younger kid thing. I get teens with this all the time. And honestly, even like I work with different healthcare providers who've come up and told me like, yeah, I don't do needles. I'm like, you better figure it out, for your own health, but they're like, yeah, I understand why this teenager is struggling that. So sometimes with teens, you gotta know your teen, because I know some of the teens, you give them praise, they roll their eyes. Do they still take it in? Sometimes you want to watch how annoying you are. You got to be the right amount of annoying for a teenager. In reinforcing some of that. But things like saying, like, acknowledging that looked really hard for you, and I'm so proud you were brave, or we did it, we got through it, or other things. I think thinking about what can you do to get through. Sometimes we use mottos like let's see, one of my colleagues here talks about being scared and brave at the same time. You can be scared and brave at the same time. And so being like, yeah, I could see you were scared and you were so brave and you did it. And so coming up maybe for a little motto for yourself, sometimes it's, I can do this, or I got this, or we got this together, kind of depending on what helps your child the most. And then kind of reinforcing that of like using some of those words in your praise then too. Like, you said you could and you did, or, kind of whatever, tying it to your child as well.
I love that. Okay, we talked about this a little bit already. Excuse me. But like parents who have had a kid go through a medical trauma often worry about like, I don't want to re-traumatize my kid. And maybe it's something where they have a condition that requires them to go to the hospital a lot. And so they're going to be there, once a week or every other week, or maybe it's several times a week for different periods of time. What things can we do as parents to kind of maybe let our medical team know about how to not re-traumatize them? I know we've kind
Yeah,
of talked about this, but like, are there specific things that we can put in place, especially when we're doing this with any kind of frequency?
love that question. I think so. That's kind of, on one hand, if you have frequent visits, it gives you the opportunity to recover and overcome your fears more. Sometimes one of the things that's hardest, like if kids are really afraid of the dentist, but they only have to go twice a year or once
Yeah.
a year, you try to cope up with that plan, but then they don't get a chance to practice as much. So if you can kind of think about it just like you do for things in school that are really, really hard, it's different with the trauma piece, right? So you're not going to force them through it the same way,
Yeah.
but that you have an opportunity to practice coping skills every single time you go.
Mm-hmm.
And one of the things that I think is something else to remind yourself as a parent, I don't think we talked about this yet today, but the number one consistent kind of protective factor that we've seen over time in research is social support. So your kid knowing that you are in their corner. And
Yeah.
if you're listening to this podcast, it likely is a parent that is in their child's corner, is looking to do right by their child, do everything they can to support their child. And so telling yourself as a parent, like, I've got this for my child. Like, I'm going to be in their corner no matter what behavior comes out, I'm there. And like, you can say things like that to them, like that I am here no matter what, and like demonstrate that social support. Then I think too, if you're at a place that has resources, like some places have like child life resources, some places have social work resources, psychologist resources to talk through. Sometimes those folks can help coordinate with the medical team, so you don't have to advocate quite as much. So if you have a mental health provider that you can work with and you can make the plan with, then sometimes they'll be able to communicate that to the medical team for you and with you.
Yeah.
That can sometimes take some of the load off.
Mm-hmm.
That's not available everywhere. I know the co-author of my book, Melissa, we wrote a book together. She's a parent of a kiddo with a very significant progressive disorder. She said she didn't have those access to the resources, which is one of the reasons she reached out when we wrote this book called The Fate of the Doctor. It's got a lot of these strategies in it as well.
Yeah.
And she described, as a caregiver of a child with a really significant medical challenge, like she was their advocate. She was their everything. She's like, it became a part-time job researching how to help my child cope and trying to put these plans in place. But things that we have found to be effective is if you can write things down for medical teams, that can really help. And then you write it down for yourself too, so it's more consistent. Or even putting notes on your phone and then just showing every medical provider that comes in the room. Sometimes when we have kids that are in the hospital and staying overnight, we'll put things up on the walls even. And then if new providers come in, you can say, hey, can you take a quick look at that? So that you don't have to keep selling the same, like verbally over and over and over, saying the same thing. If you know things that are helpful for your child. And then again, if it's something you're needing to work through, if it's kind of at that really significant level, it is really helpful to have a mental health provider to help you sort out like the exact steps of what could be helpful for your kiddo.
Yes. Well, and I heard you saying like you advocating for your kid in that situation, saying like, hey, here's the list, or have you read our list? Or do you know what we're like our strategy for today? Like your kid's watching you do that too. And so like that is even more emphasizing that social support of like, I've got your back. Like I'm here. I'm going to make sure to the best of my ability, because we can't control other people. Like we can just give the information, right? Like to the best of my ability, I'm going to do everything I can to advocate for you and to do it the way that is best or in your best interest, even though sometimes it might be hard. And then it's also explaining like, hey, the doctor let me know this, or like, can we talk to Sue about why we can't do it this way? Or can we explain that? Or, can you explain to me so that I can make sure that they understand? So those ways we're like even more emphasizing those social supports that we have in place.
Yeah. And definitely the other thing that does is it models for your child how to advocate for their own health and needs.
Yes.
And so in addition to showing your child, I've got you, I've got your back. You are in my corner. I've got you in my corner. Wait, I think I said that opposite. I'm in your corner. That's right.
Same difference.
Like, there's a corner in here somewhere.
Yeah.
And, but like, I've got your back. It also shows your child, and we've had some kids oh my gosh, the way they advocate for themselves, it's so beautiful. I love seeing it
Mhm.
where they'll be like, yep, I have to get an infusion today. This is the arm that I wanted in.
Mhm.
I need my numbing spray. I need my Buzzy Bee. This is
Mhm.
how I do. And they do it in such an appropriate, not whiny, not demanding, in a just an appropriate way of advocating for themselves.
Mhm.
So if your child's not there yet and they need you to do that advocacy, you are modeling for them too, that even as they progress through their healthcare, like they can ask the doctors questions if they don't know
Mhm.
the answer to things. Like
Yes.
they can advocate for themselves. So you're
Mhm.
also modeling that for your child.
Yes, I love that so much. Okay, so talk to me about I mean, we talked about this a little bit in terms of age appropriate, but like, is there too much honesty that we can have versus like too much reassurance about, the medical procedure that's coming up if our kid's feeling frightened?
There is some pretty decent research out there that shows that reassurance can actually increase anxiety.
Mhm.
So I think it depends on kind of how you frame it. If you can frame it for yourself or for your child and say, you're really brave, I know you can do this,
Mhm.
versus it's going to be okay, everything's going to be okay, it's not going to hurt, you'll be fine, you're okay. Like that's a little different, I
Yeah.
think, too. So depending on how you're like delivering the reassurance, one thing that we use sometimes in for some procedures is we call it like one voice, so that not everyone's talking to the child at the same time. I don't know if you've ever been in a situation where a kiddo starts to have trouble with a medical event of some sort. It could be a needle stick, it could be an ear exam, and then more people come in to help and more people come in to help, and everyone's talking and everyone's trying
Mhm.
to reassure and say, no, it's okay, no, I'm this nurse, oh, I love your outfit, and like it gets
Mhm.
loud and it gets like more
Yeah.
escalated. So sometimes what we do is we recommend just one person is the designated speaker, and that person is going to say, okay, Susie's going to do this now, she's getting the tourniquet on for the blood draw, she's wiping your arm with the alcohol now, and just like very concrete, like this is
Mhm.
what's happening.
Yes.
So, I think it's okay to reassure a little bit, of course, like if that's your natural parenting style. We don't want to take that from anyone, but you
Mhm.
don't want to do that over and over again, reassuring, because I think the message it sends that is that if you have to reassure so much, there must be something wrong,
Yes.
because your parent wouldn't need to do all that reassuring
Mhm.
if it wasn't a big deal, really. And
Mhm.
so I think there's that piece of that. And I forgot the other part of your question. One was about
Oh, just, balancing honesty and
the
reassurance. Yeah.
honesty.
Mhm.
Yeah, so I think the honesty piece is tricky because there are occasionally there's a lot of detailed information that kids probably don't need to know. I
True.
think I would strongly encourage parents to share terminology that they might overhear and what it means. Because I
Mhm.
know I've been in some situations where parents haven't wanted to share like the name of the diagnosis with their child,
Mhm.
but then they're going to a clinic and like people are using the name of the diagnosis. And sometimes what happens when we're not giving our child basic information is they make up all kinds of stories in their mind about what might
Mhm.
happen. I know there was a teenager at one point that was participating in one of our research studies, and they were talking about like kind of what was the scary parts of um, having an injury. It was a kiddo that had a real bad injury, and they said, well, once I understood that they would give me medicine to go to sleep to fix my leg, I felt a lot better. But
Yeah.
this whole time, this teen had envisioned having a surgery while they were awake on their
Mhm.
leg, and their anxiety was real, real high. So, again, thinking about no one thought to stop and
Mhm.
explain and give that information.
Yes.
Um, so, trying to balance and know, again, your kid, like what's the right amount of information. Kids often want to know kind of what's going to happen next, how's it going to affect me.
Mhm.
A lot of kids don't want to know the back to details of like
Mhm.
or like a 3-month plan. You
Mhm.
might say we're going to be going through this for a few months, our first steps are X, Y, and Z.
Yeah.
Do you want to know more? And that's always
Mhm.
a good question. I do caution parents to, I would say I would not cover things up, and if your child's asking questions, providing honest answers is
Mhm.
generally the guidance we give.
Yeah. Well, and I think it's okay to also not know the answer, right? So like
Absolutely.
your kid asks you a
Absolutely.
question and you're like, actually, this is new to me too. I will find out. Like I'll contact the doctor or call the
Yep.
nurse and we'll get some more information. And sometimes that may be also the time, maybe enough, like you've done Dr. Google and like all the worst things. And so
Mhm.
for you
Mhm.
to process that information and then be able to come back with a way that is like helpful for your kid, right?
Yep.
Because I think catastrophizing it is not the right strategy,
Mm-hmm.
right? But I think under informing maybe is also not the right strategy. And it's based on your kid as to which would be catastrophizing versus which would be under informing. And I know that like I always wanted to know all the information, right? And then I'd be like, and then what do they do? And then what do they
Yeah.
do? And
Yep.
then what do they do? And my parents would be like, okay, right? Like, and so thankfully I didn't have to go through any childhood cancer treatments or anything super big, but I think I just wanted to know all the
Mm-hmm.
strategies because that
Prepare
helped
yourself.
me to be
Yeah.
prepared, right? Because then it felt like if something happened that I wasn't expecting, I'm like, you didn't tell me that. And they might have thought like that was such a minor thing. But for me,
Mm-hmm.
it was, one of the things in the process. So like figuring out what helps your kid succeed in other areas probably it could be a good strategy that would help them
Yeah.
to succeed in this area and feeling that out. This has been such a great conversation, so helpful. Is there anything that you want our listeners to especially leave with today?
Yeah, just a couple things. One thing that I always like to put in every talk that I do and everything that we write is, again, we always talk about also like making sure we're keeping our kids safe. So if any time kids are making comments about self-harm or harm to others, we always take those really seriously. Talk to your pediatrician, take kids to the emergency room if you can't keep them safe. We always suggest, taking those kind of comments seriously and following up on those sorts of things. That can happen in the context of medical trauma sometimes as well. Sometimes kids will yell out things in that moment that are kind of, they're scary to hear. And so always making sure you're following up and taking those kinds of things seriously as well. So we always, encourage folks to pay attention to that. And then the other thing is just, I think, just remembering you as the parent or the expert of your child and empowering you to talk to your medical team. And if there's things you don't know what to say or how to share information with your child, asking your doctor for help too, or making a list of questions with your child and having your child have a little notebook to show the doctor. And then the doctors can help you figure out how much information to share also as you're preparing up.
Yeah. And they'll ask more questions too. Like if kids don't get enough information, oftentimes they'll say, yeah, but that doesn't quite make sense.
Mm-hmm.
Or like what happens in between this? Or they might be like, that's good, right? Like
Mm-hmm.
that was all the information I needed. So like allowing our kids to also listen to themselves and know what feels like it's the right direction for them too is helpful.
Love it. Yeah. And so just thinking about, if your child is struggling with medical anxiety or medical trauma, that thinking about you do have an opportunity. You don't have to just power through. I think old school way back, the idea was just power through it. Mm-hmm. There are so many things you can do to help your child. And there's a lot of resources out there as well that you can kind of work through to try to help your child through the different kind of just challenges and stressors. And some of those skills that you teach them in dealing with medical trauma or anxiety can be generalized for other areas of their life as well. Absolutely. And so something to just kind of keep in mind as you're navigating parenthood and the health and wellness of your kiddo.
Yeah, absolutely. Thank you so much, Dr. Marsac. This has been such a great conversation.
Yeah, thank you. It was great to meet with you and get a chance to chat with you today.
Yeah. Okay. I'm going to end it. It will upload from your side too. So stay with me for a sec. Thank you again, Dr. Marsac. That was all really helpful information. I know none of us want our kids to experience medical trauma, but it is so helpful to know the things that can help us to navigate those realities if they have already happened, as well as to prevent potential things from happening to help our kids feel better about medical intervention and experience with medical providers. With that, I will say thank you so much for your time today. If you would do me a huge favor before you check out today, if you would hit that subscribe button, that would be greatly appreciated. We would also love for you to share this episode with anybody that you think could benefit from it, as well as checking us out on Facebook, Instagram, TikTok, and YouTube. And keep the emails coming, please, guys. We love your topic suggestions to accidentalexperts@gmail.com. That's accidentalexperts@gmail.com. Have a wonderful day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.